Hello guys, hello and welcome to my channel. This is Isaac, Simple and Real. Karibu sana to my channel. Today we are going to talk more about HIV prevention or post-exposure HIV prevention. Now, kindly before we start this topic of today, or post-exposure prophylaxis, kindly remember to like, subscribe, share, let more people be able to understand more about HIV and how we can be able to prevent HIV. Remember, being positive about HIV is not necessarily being HIV positive. Thank you. Now, in our topic today, we shall dwell much more on PEP or post-exposure prophylaxis. This is how we'll be able to avert the spread of HIV infection, and is the most thing that most people fear because of not knowing, and others get get HIV infection because of ignorance. Now, I'd like us to be able to understand so that we may not be ignorant about the same. Thank you. I'll give you about 2 seconds that you may be able to subscribe to my channel, and this is your time. Thank you for subscribing to my channel, and God bless you. Now, in my topic today, let us be able to understand what is PEP or what is post-exposure prophylaxis. And this is a kind of treatment that we offer you when you engage in a risk that can lead you to having HIV infection after it has occurred with a person of a known HIV serostatus, or a person who is non-HIV or who is of non-HIV serostatus and you are HIV negative. Now, this kind of treatment is usually given for about 28 days, 20 to 30 days. And what are the qualifications of someone getting PEP or post-exposure prophylaxis? To begin with, a person who qualifies to get post-exposure prophylaxis treatment is a person who has admitted to be tested of HIV infection, because you must be HIV negative for you to qualify for PEP. The other thing, for this drug to be able to work in your body effectively after you have engaged in a risk, you must have engaged in the risk within 72 hours before you presented to the health facility. So that, because within 72 hours, there is optimal effects on treatment with the PEP prophylaxis. Now, what are these risks that we usually offer PEP? One of the risks that we do offer PEP is one, for the healthcare worker or any other person, when you have a needle prick. A needle prick is usually a needle prick after you have pricked the patient, not a needle prick with a new needle. That one is not necessary. But a needle prick, when a healthcare worker is attending to a patient, maybe a HIV testing is being done, and you prick yourself after pricking the patient, you may require to get PEP treatment or a PEP regimen treatment. The other person is having unprotected sex. This is a thing that usually happens every time, and some people get they feel stigmatized, or they feel it is not very necessary, or they feel ashamed to go and ask for PEP, even if they don't know the HIV serostatus of their sexual partner. And your sexual partner may be HIV positive, and you don't know. And because of ignorance or because of shying to get to a health facility and being tested so that you can be prevented from HIV, you end up becoming HIV positive. And this will increase the burden of HIV in our country. Or else, you will also start carrying the same burden that we are trying to reduce in our country. And this is very important for us that when you have unprotected sex with a person of unknown HIV status, the best thing is either you get tested, both of you, so that you can be able to array these kind of fears. And if your sexual partner is HIV positive, you can be able to initiate PEP, knowing the HIV status of your sexual partner. The other one, if you are both negative, now there is no need for you to be able to be using this kind of PEP, because PEP is not for those who are continuing to have sex on a daily basis. It's only for those that it just happened and you have to prevent it, because it's once and for all. And maybe it's once after a very long period of time, it's when you'll be able to meet again, maybe for a sexual intercourse. And the others, which is much very rare, could be blood transfusion with a blood that is of a person who is infected with HIV, which that is very rare because blood for transfusion is highly screened for HIV, and you cannot be transfused in a health facility blood with HIV virus. The other one is maybe sharing cutting objects, especially in our households. We will be having relatives who are HIV positive, and at a mistake, they may cut themselves, and we find ourselves being cut, or having a blood contact or a fresh wound contact with your fresh wound. And this is especially when we are taking care of them, this may happen, and it is very necessary for us who are not HIV positive or who do not know our HIV status to go and get tested so that we can be prevented with this post-exposure prophylaxis treatment. Now, let us be able to understand more about PEP. Now, after you have been tested, or maybe after this has occurred, before you visit a healthcare facility, what are you supposed to do? Let me start with do's, then I'll go to don'ts. Or rather, let me start with don'ts. First thing, when you get that skin contact, or maybe a needle prick contact, please wash it with the running water, but do not express bleeding. When you express bleeding, you cause more harm. And when you press it more, you'll also provide a severe, or rather, you'll be causing more harm to yourself than good. And this may cause even a secondary infection with other bacteria that are on your skin or in the environment. So do not express it. The other thing, do not cut it further, because when you're cutting it further, you're increasing the surface area of infection. So just clean it on a running tap, and then if it's so much bleeding, just cover it, give it a firm cover to prevent further bleeding, and then visit a health facility. If it's a large cut, it can be dressed with sterile gauzes, and maybe you can be able to be offered that is tetanus treatment and antibiotics to prevent secondary infection. if it's just a minor prick, after you have pressed it firmly, automatically the bleeding will stop. That is after you have cleaned thoroughly with the running water. The other thing, you will be tested for HIV, and upon confirmation of a negative serostatus, you will be initiated on treatment. You'll also be counseled on adherence and also on trauma counseling if in case it's a rape incident. Now, this kind of treatment is usually given for 20 to 30 days. After 28 to 30 days, what happens? Usually after 28 to 30 days, you will be tested again. And this is very important, especially this is to affirm that you are now HIV negative. In some instances, if you didn't have good adherence to PEP for the past 28 days or past 30 days, it may end up becoming positive, and this is very much worrying. So it is very good if you are tested and you are confirmed negative, please make a good adherence to treatment, complete the dose, so that after 30 days you'll not have to worry again. Now, after this completion of this treatment, you'll be able to be addressed on the trauma counseling, and then you are discharged, either positive or negative, depending on your adherence to this kind of treatment. So this is what happens when you visit a health facility after getting exposed in a risk that can lead to HIV infection. And this process of testing usually takes 15 to 20 minutes. And also, it's very necessary for us to be able to prevent ourselves when we have the chance, rather than getting treatment when we are too late. Remember, prevention is better than cure. And together, we can be able to avert HIV stigma when we all agree that is here and it is here with us, and we become positive about HIV. Remember, being positive about HIV is not necessarily being HIV positive. Thank you for watching my channel. Kindly do not forget to like, subscribe, and share my channel so that more can be able to learn more about HIV, and we can be able to avert HIV stigma in our community. Thank you and God bless you. Bye bye.